Welcome back, gentlemen. This is the Peter Whyte Podcast. I'm your host, Dr. Peter Whyte, urologist and men's health specialist. Today, we're going deep, literally, into the science of erections. We're going to break down what actually happens inside your body during an erection, what causes erectile dysfunction, mentally and physically, whether pornography really messes up your ability to perform, how to prevent erectile dysfunction, and how to reverse it naturally. Stick around, because some of the information in this episode can genuinely change your future bedroom confidence and maybe even save your life. Let's start with your anatomy, because when you understand your equipment, you can handle it better. The anatomy of your erection. Your penis is more than what you see in the mirror. Inside, you have two spongy chambers called the corpora cavernosa. These are like natural balloons. They fill with blood. Running through them are arteries delivering fresh blood, while veins around them drain blood away. Surrounding everything is a tough, stretchy tissue called the tunica albuginea. Think of it like a pressure jacket. When you get aroused, this tissue expands, squeezing the veins shut, which traps blood in the penis and keeps it firm. Fun fact, the strength of this tissue has been compared to steel wire. I know, impressive. Inside these chambers, blood pressure skyrockets during an erection. We're talking 3 times higher oxygen levels compared to when you're flaccid. No other organ in your body does that. Respect. But here's something many men don't know. The penis extends far deeper into the pelvis than what you see externally, which is why stimulation behind the testicles can feel surprisingly good for many men. The 3 types of erections. Not all erections are equal. You have 1. Reflexive erections triggered by touch, physical, automatic, no conscious thought. 2. Psychogenic erections triggered by visual, emotional, or mental stimulation. These are what most men think of when they say, turned on. 3. Nocturnal erections. These happen during sleep. Most men have multiple every night, often without knowing. Morning wood? Completely normal. And a great sign your plumbing is working. If you're struggling during sex but still waking up hard, that usually tells me it's more mental than physical. Random erections. Especially in adolescence, random erections simply happen because the body wants to keep penile tissue oxygenated. It's maintenance work. If you get a spontaneous one in public, breathe, distract yourself, don't panic. Anxiety feeds the nervous system that kills erections. The role of the brain. Everything about erections begins in the brain. When aroused, neurons release nitric oxide, the chemical spark of erections. It tells muscles in the penis to relax and open the floodgates. Remember that term, nitric oxide. We'll come back to it. Psychogenic, mental ed. Almost every man experiences mental erectile dysfunction at some point. Performance anxiety is real. Will this work? Will she enjoy it? What if I lose it? That inner voice can shut down arousal instantly. Relationship tension, guilt, depression, stress, all of these reroute blood away from your genitals. Why? Because cortisol, your stress hormone, is an erection killer. Mental ED is a loop. You worry, you lose it, now you worry more, it gets worse. Breaking that loop is essential. Strategies include breathing exercises, communicating with your partner, slowing down, cognitive behavioral therapy, temporary medication support, vascular ED. This is the most common physical cause. If blood can't get in or escapes too fast, erections fail. Common contributors: high cholesterol, high blood pressure, diabetes, heart disease. All of these damage blood vessel lining, reducing nitric oxide. Remember that spark? Long-term poor blood flow can lead to fibrosis, permanent scarring inside your erectile tissue. That's the point of no return. This is why early lifestyle change matters. Also, venous leak happens when blood escapes faster than it can be trapped. sometimes due to a weak tunica albuginea. Diabetes and ED. If you have diabetes, you are significantly more likely to develop erectile dysfunction. Why? Damaged nerves, damaged blood vessels, reduced testosterone. Almost half of diabetic men experience ED. Medication. Induced ED. Common culprits. Antidepressants. Some, not all. Anxiety medications, blood pressure medications, antihistamines, recreational drugs. Never stop prescribed medication without speaking to a doctor, but alternatives exist. Neurological causes. The nerves from your spinal cord to your penis are delicate. Things that can damage them. Spinal injuries, surgery in the pelvis, multiple sclerosis. Some cancers. Think of nerves as wires. Any kink affects signal strength. The hormonal component. Low testosterone doesn't automatically equal erectile dysfunction, but it can lower desire, confidence, and erection quality. Other hormones like thyroid and prolactin also play a role. Smoking, alcohol, and drugs. Smoking reduces blood vessel elasticity and can literally shrink penile tissue over time. Heavy alcohol lowers desire, disrupts nerve signals, lowers testosterone. Cannabis long-term can interfere with blood vessel function and hormone signaling. Opioids can destroy libido entirely. Why erections are a health warning and can predict heart disease years before chest pain. Why? The arteries in the penis are tiny. They clog first. If your erection disappears today, your heart might be in trouble tomorrow. Get tested. Blood sugar, lipids, testosterone, blood pressure, EKG. Erections are your body's early warning system. The million-dollar question: does porn cause ED? Here's the truth. There is no strong clinical evidence that pornography directly causes erectile dysfunction in healthy men. But porn can contribute to psychogenic ED if you prefer porn stimulation over partner intimacy. You condition your brain to extreme novelty. You develop guilt or conflict with your values. You masturbate aggressively in ways sex can't replicate. The brain adapts to whatever you reward it with. If porn becomes your primary sexual outlet, partnered sex may feel less stimulating. Not a physical problem, a brain behavior loop. Moderation matters. The fix. Natural, practical steps. 38 were. 1. Exercise. 30-60 minutes of moderate aerobic exercise, 3 to 5 days a week. Improves blood vessels, nitric oxide, testosterone inflammation. 2. Sleep less than 6 hours nightly, lower testosterone and weak erections. Aim for 7 to 8 hours with real REM cycles. 3. Diet Mediterranean-style eating reduces ED dramatically. Fruits, vegetables, legumes, whole grains, fish, olive oil, nuts. Avoid excess sugar and processed meats. Specific helpful foods: dark chocolate, citrus fruits, apples, kale, green tea, watermelon, arginine precursor. 4. Weight loss. Even losing 5 to 10% body weight significantly improves erection quality. 5. Limit alcohol, more than 1 drink a day. Hormone disruption. 6. Quit smoking. You'll literally preserve penile size. 7. Manage stress. Stress kills desire, blood flow, and confidence. Meditation, therapy, journaling, breathing, all help. No sex life? Still pay attention. ED is a window into future heart disease, future Alzheimer's, cognitive decline. Blood flow is universal. Brain, heart, penis, all connected. When to seek help. If you can't maintain erections, can't get morning erections anymore, have diabetes or heart risk factors, have sudden changes in size, shape, or curvature, see a doctor. You are not alone, and you are not broken. Closing, gentlemen. Erections are more than pride or masculinity. They are a marker of your cardiovascular, neurological, hormonal, and mental health. Porn isn't the villain. Habits are. Your lifestyle matters. Your sleep matters. Your relationships matter. I'm Dr. Peter Whyte. Thank you for watching. If you want a part 2 on supplements, treatments, or bedroom techniques, drop it in the comments. Take care of your health, and your health will take care of your erections.